Odds are that, throughout the years, you've used many types of medicine to fight pain and inflammation. NSAIDs are one type of pain reliever that most consumers are comfortable and familiar with. But the majority of people have no idea what an NSAID is. So what is an NSAID? NSAID stands for non-steroidal anti-inflammatory drug. That means that NSAIDs contain no steroid elements. They're also non-narcotic. In fact, many of us consider them to be among the safest medicines we can take. The most commonly used NSAIDs are aspirin, ibuprofen, and naproxen sodium, although there are dozens more with less recognizable names. Typically, they're sold over the counter, but prescription drugs also are often NSAIDs as well. As you walk through a drugstore, you expect to find NSAIDs in many of the products sold in the pain relief aisle. What you might not expect, however, is that those same NSAIDs are also in cold and flu medicines, as well as analgesic muscle creams and pain relief patches. In fact, if you could tell which products contained NSAIDs, your drugstore shelves might look like this. So it's easy to get more NSAIDs than are good for you. The recommended dose varies with the specific NSAID you're taking, so ask your healthcare professional how much is safe for you. This is important because too many NSAIDs can irritate the stomach lining, cause bleeding, and occasionally lead to ulcers. There are also risks for your heart and kidneys. That's why the only safe way to use NSAIDs is to take the lowest effective dose for the shortest period of time. So how do you use NSAIDs safely and effectively? The easy answer is, know what you're taking and how often you take it. What you don't know can hurt you. That sounds easy, but think about this. You take your usual pain relief prescription. Each dose contains an NSAID. But today you have a cold, so you take 2 pills for a headache and a dose of cold or flu relief medicine. You've just added more NSAIDs to your body. Muscle rubs, pain patches, and prescription drugs can add even more NSAIDs to your daily quota. In a few hours, you repeat the headache and cold medicines and take them once again before bed. And before you know it, you've taken way more than the safe and effective daily dose. So how do you make sure you're using NSAIDs wisely? First, read the labels. Then ask the pharmacist to help you make sure you choose over-the-counter medicines that work well with any prescription NSAIDs you may take. Remember, your goal is to take the lowest effective dose for the shortest period of time. Be smart, be safe, and get relief without harmful side effects. When it comes to NSAIDs, what you do know can't hurt you.